And joining me now on India First is Singh Deo, the Health Minister of Chhattisgarh. Minister, welcome on India First. How do you see the vaccination for all drive rollout starting the 1st of May? And when is Chhattisgarh likely to begin the drive?
We are starting tomorrow, Gaurav, and it's an uphill task. Uphill in the sense that we have limited vaccines in the country. But whatever vaccines would be available, even in this lockdown, we'll try and see that as many people as vaccines are available get covered and vaccinated.
Excellent. Sir, there was an apprehension that there could be a lot of crowding, and Delhi Chief Minister Arvind Kejriwal has asked people between the age group of 18 and 45 not to queue up at vaccination centers till the time things are better. Sir, you've placed an order for about 25 lakh vaccines with the Serum Institute and another 25 lakh with Bharat Biotech. How soon are they likely to arrive, and what is your total requirement?
We will be placing another 25 lakh vaccine order with Serum Institute. Bharat Biotech has been more forthcoming, and they are making 1,50,000 vaccines available tomorrow morning. So those are the vaccines with which we are going to start. We will be rolling them out tomorrow. Those places where logistically the vaccines will not reach tomorrow, they will be covered, started from day after.
And no issues with Bharat Biotech's vaccine, Covaccine anymore, because the centre, as recently as a couple of weeks ago, had accused Chhattisgarh of fueling vaccine hesitancy. Has there been a change of heart when it comes to Covaccine?
The issue was not about Covaccine, but the methodology that was adopted, and I am still on the same platform, that we must follow internationally accepted protocols even under emergency use authorization. So when Covaccine was rolled out, it was under emergency use authorization, but under clinical trial mode. So you were having to sign forms, etc., and then take the vaccine. After the government of India removed that provision for clinical trial mode, you no longer need to sign a form when you're taking the Covaccine injection. So that is when we also started using Covaccine.
The opposition, sir, has accused the Chhattisgarh government, in their words, of being lethargic and leaving the heavy lifting to the centre. Is there merit in the allegation that governments, the state governments, should have reached out to manufacturers earlier instead of letting centre or waiting for centre to do all the work?
We were not waiting for the centre after the announcement. In fact, Chhattisgarh was one of those states who reached out, placed orders, and has been able to secure, no matter how small a quantity, we have been able to secure the vaccine. And you had also mentioned vaccine hesitation. Had any step taken by us, whether regarding Covaccine or any other, had it engendered vaccine hesitation, Chhattisgarh would not have been among the leading vaccinating states of the country. We have reached about 16.5 to 17% coverage, whereas the national average would be 8.5, maybe reaching 9, 8.5, 9. So vaccine hesitancy is another bogey which unfortunately our friends from the opposition are raising in Chhattisgarh.
Okay. Pricing remains an issue even now, Mr. Deo. Our states and the centre, why are they not coordinating on this drive, or are they coordinating on this vaccination drive between 18 and 45? And as the Health Minister of Chhattisgarh, what are your expectations of the centre from this point on?
A national program, a national vaccination program. This is the first I'm hearing in the history of the country since independence that a national program has been split into Government of India partaking some responsibility and the state's government being asked to take the other. In fact, it is 1:2. If 1 crore people are being vaccinated by the Government of India, 2 crore have been left to be vaccinated by the states. So this is most unfortunate as far as that policy decision goes. I still feel the Government of India, though I doubt very much it will reconsider, it must reconsider and go back to the common platform of the Government of India purchasing the vaccines and supplying them equitably to all the states.
Will Chhattisgarh also be looking at foreign vaccines in times to come, or would your entire requirement be met either by Serum or Bharat Biotech? You know, Sputnik comes in, others likely to come in?
The issue is the approval of any vaccine made abroad by the Government of India agencies. So once the Controller General approves any vaccine which has been produced internationally, we would be happy to reach out to those companies and purchase them if they are cost effective and use them in the state. Also, if local manufacturing is not ramped up enough and the vaccination program is getting delayed beyond acceptable timeframes, then we'll certainly reach out to foreign manufacturers or vaccines available in other countries, subject to the Government of India permitting us to do so.
Mr. Deo, for the moment, many thanks for joining me here on India First.
Thank you so much, Gaurav.
So there are problems